Hello. Hi, everyone. Good morning, good afternoon, good evening, whatever part of the world you are joining us today. I'm so sorry we are a few minutes behind schedule, just a few last minute logistics. You know how things go. Thanks, everyone. Let me know where you're joining me from. Our audience on Facebook, also on our YouTube channel, and also on my timeline. You're welcome. Today is day 3 of the Autism Renewed Conference 2023. And wow, how time goes really so quickly. I'm sure for those of you that have been with us for the past few days, you know that there's been so much value shared these 3 days. On the first day, we had Dr. Patrick Riddell. Yesterday, we have Mrs. Olufolake Ayeyemi. And today, yes, it's just me, myself, and I today. Well, I guess I'm not alone because I have so many people joining me. Thanks, everyone. And we're just going to get right into it. So I'm going to be sharing my slide with us today. So let's go. And let me know if we can see my slide and if you can hear me right. Okay. So please let me know. Can we hear me and can we see my slides? I appreciate your feedback. Yes, let me know if you can see my slides and if you can hear me. Okay, let me check Facebook. Please let me know in the comment section before I proceed. Okay, can we see? I'm waiting to see. Can we see? Oh, what am I pressing? What happened? Okay, let me see. I can't even see. I can't see the comments now. Let me just go back. Wow. I think my phone just went off. Let me just see. I can see the slides. You can hear me. Okay, thank you so much for that feedback. Okay, I think I know what I'm going to do. Let me check my Facebook here. 1 second, please. Okay. I don't know why my streaming is a little bit. Okay. Just 1 second. Thank you. You can see the slides and you can hear me. Oh, okay. Thank you so much, everyone. I think let me just proceed since we all can see me and hear me. Let's go. It's I think I have to go back again. Yes. Thank you for that feedback. Appreciate it, everyone. I'll just So welcome to why is it showing day 2? Sorry. Okay, day 3. Welcome to day 3 of the Autism Renewed Conference. And like we all know, the theme of the conference is overcoming speech delay. So let me see. Sorry, there's something I would just want to check real quickly. Overcoming speech. Let me see. Sorry, there's something I would just want. Okay. So now let's move on. A little bit about me. My name is Dr. Lola Okelwo. I'm a medical doctor and I'm an autism professional. I'm the founder of the Autism Renewed and also the creator of the Milestones Acceleration Method. As a medical professional, I have a passion for supporting parents of children diagnosed with autism or developmental delays. That led me to further study and acquisition of more knowledge. So now I equip parents with several tools and strategies that help them navigate developmental challenges in their children with autism and help these kids to thrive, especially in their speech and language. Yes, I know some parents here that kids don't have autism, but they have speech delay. And yes, you can also benefit from the strategies that I teach or I share. So a little bit about Autism Renewed. Autism Renewed is an organization that I founded, and our main goal is working with parents of children diagnosed with autism and supporting them, especially in their speech and language development. But for people who have kids who don't have a diagnosis, but also have speech and language challenges, we also support them. And like I always tell parents, because I have some parents here who have reached out to me saying that their kids don't have autism but just speech and language delay. And I always say it's not about the diagnosis, it's about being able to individualize your child and being able to support your child with whatever challenges they have. So when it comes to autism, one of the challenges kids could have is speech and language, but other challenges also come into play, like social, like behavioral. So it's not really about a diagnosis, because really, what does the diagnosis do for you? A diagnosis will help you, depending on where you reside, to access services, because in most parts of the world, without a diagnosis, kids are not able to access services for free or from insurance. And sometimes that's what a diagnosis will help to do. And also, a diagnosis would also help to know other factors that may be ongoing, and you have to put this into consideration because it affects the effectiveness of whatever therapy or strategies you're using. So you cannot isolate just that challenge. So that is why a diagnosis is important. So for example, if a child has behavioral issues and you're still trying to work on speech and language, you have to factor that in. If not, it could be impeding or affecting or interfering with the interventions you're trying to put in place. And also there could be also other associated medical conditions, and you need to factor this in. So that's what really a diagnosis does, because a diagnosis does not equal a particular treatment. So a child is diagnosed with autism doesn't mean that it equals this particular treatment. It's not like malaria. They say a child has malaria, then you prescribe maybe artemether lumefantrine, take 2 times a day or for 3 days, things like that. No, there's no one equal treatment or management or intervention. Even when it comes to speech, when you say, okay, child has speech delay, let the child go for speech therapy. Speech therapy is not just one modality, because there are different levels of challenges with even with speech delay. So every child will still, at the end of the day, you have to individualize the child and be able to identify where the child has challenges and begin to support that child. So I just wanted to make that clear as we begin, for parents who their children don't have a diagnosis. And some kids, maybe because you've not done an assessment, and also depending on the age of the child, if the child is pretty young, other things that may be happening you may not know yet, or they may not become apparent or clear. So you don't have to wait, and that's why it's good that you are here. So it's really not about the diagnosis. So let us proceed to my next slide. Oh, what's happening? Okay, so today I'm going to be talking about teaching your child to talk. Teaching your child to talk. But I wanted to say something. Okay, talking is a learned skill. Talking is a learned skill. Even though for most people it looks so easy, like a child just starts babbling, nobody ever taught you to talk, or you didn't, maybe you have another child that is talking and doesn't have speech issues, but it's a learned skill. But one thing I want to say is this: in terms of when I use the word teaching, I want to define certain things, because a lot of people's definition of teaching, is different from the way I look at it. I feel the real way, when you say teaching is not that I'm trying to say telling someone, do this, do that. That is not exactly teaching, because you will be like, how do you teach a child to talk? Do you understand? So when I'm talking about teaching, for me, even aside talking, teaching a child anything or anyone anything, what does it entail? It entails, I hope you can hear me. Okay, you can see and hear me. Let me know if at any point in time you can't see me or see my slides, or you cannot hear me. Thanks everyone again. So when I talk about teaching your child anything, any skill, any maybe even teaching them how to do chores, teach what does teaching entail? Entails acquiring knowledge, acquiring information, being intentional, creating a system, creating a process, creating a structure, and you break it down and begin to walk the person through all the levels. That is what teaching is. So when I'm saying teaching your child to talk, I'm not saying you sit down and tell your child, say this and say that. That is not teaching. Even as parents, because I know a lot of us here are parents, some people are educators here or caregivers. When you say teaching a child anything, any skill that you want to teach a child, because the goal of a skill is what? Learning the skill and gaining mastery. So you can't even be talking about mastery without even learning the skill. And how do you learn any skill? Think of any skill. Oh, people that know how to play soccer, people that know how to sew, even any skill, even around the house, cleaning, sweeping. How do you learn any skill effectively? And that's why you see a lot of parents even struggle. Oh, my children, they don't know how to do this, they don't know how to, and I've talked, I shout, and you know it's because you're not teaching. You're talking doesn't mean you're teaching. I mean, you're telling them doesn't mean you're teaching. Teaching involves, when you're teaching to learn a skill, including speech and language that we're talking about today, it entails you must have the right knowledge and the right information. So for some parents that think that a child is being lazy, that's why the child is not talking. That means your knowledge and information, you are even wrong. So how do you even begin to teach correctly? So teach, you get the right knowledge. Then you must have a system, a process, a structure. Then you know how to break it down and take the child, it's like you're taking someone on a journey. Because what happens is this: if you don't have a system, if you don't have a structure, you don't have a process, how do you even know along the line where a child needs help and where you want to come in? You don't know where a child is because you don't even know the journey you're taking the child on. So when I'm talking about talking as a learned skill, teaching a child to talk, I'm not saying telling a child to say this. No, as we go along, we will begin to understand. But I want you to have this at the back of your mind. Talking is a learned skill, and to learn any skill, you teach it. And to teach it, you must be correctly informed, you must have a structure, you must have a system, you must have a process, you must be intentional and be consistent. That is what we're talking about. So moving on to my next slide. I want to give a little background. There's a difference between speech, language, and communication. Even though sometimes speech, language, sometimes for lack of a better word, we tend to use them interchangeably. But I want to really break it down for us. Speech is just the words. Okay, speech, like I'm just using these words, come, go. I mean, like I'm using words. That is the speech. Language is now taking your words and using it, in a context. For example, you want to learn another language now. You want to learn French. So your ability to be able to take words in French and be able to use it to communicate or interact. That's when we're talking about language. So some children have speech, but they don't really have language. So the child has maybe one or two words, but sometimes they don't even use it in the right context. Sometimes it's like the child just hums, and you don't even, the child is saying words, but you can't even really tell what the child is saying. So the child doesn't have language because they are not using the words or the speech that they have to interact or to communicate. Okay, and when it comes to language, you have receptive, what we call receptive and expressive. Receptive means the ability for the child of the child to understand. Then expressive means that for the child, the ability of the child to be able to express or vocalize or interpret what they are hearing or what they are being told. So for some children, some people will say, "Oh, I know my child understands everything I'm saying. If I say give instructions, the child can follow the instructions." But sometimes the child understands, but the child has difficulty in trying to express. The child wants something. I know she wants it. I know she understands, but she has challenges with expressing herself. So most times, that's what I was talking about. You have to be able to break things down so that you identify the area the child needs support and you're able to help. You identify the area that is a strength for the child, and you can fund that and begin to help the areas that the child is having challenges. Then communication Do you understand? What does communication mean? Because the goal of speech and language is for communication. And you know what? Communication is ability to, express and interact with people. But communication is not just verbal. And that's one of the things I want us to know. Communication is not just verbal. We have verbal and non-verbal communication. So sometimes that a child is not talking does not mean the child is not communicating. So the first thing you have to ask yourself as a parent or a caregiver and educator is that, can this child communicate? First of all, communication can be non-verbal. Like we all know, you can communicate with your eyes, you can communicate with body language. So some people will know that a child wants something, and sometimes the child can communicate it by either taking you there, holding your hands, or using gestures, or things. Other forms of communication could be sign language. Some children know about sign language. Some children use pictures, and they can take they can show you a picture of what they want. They can take you there. Sometimes, like a child wants to go to the toilet, the child starts shaking or wriggling. The child is communicating. What the child now lacks is language to be able to express that communication, because it's very, very important. It's very important because the goal of speech and language is to be able to communicate, and functional communication. That's why you hear some people say things like, oh, my child can read, my child knows 1 to 100 or 1 to 500, knows all the alphabets, knows colors. But you know what is the goal? The child may know so much, but are the things that the child knows, are they functional? Can they use them to communicate functionally? So a child knowing how to count 1 to 100, yes, it's a good sign because it shows that the child has ability to acquire language or to talk. But if that communication is not functional, then there's really no goal. There's really no effectiveness. You can't really use that to measure a child's ability, or how well they are doing in their language and speech development, because they can count, because they know colors. For example, some children can read. There's something we call hyperlexia. And that is children who can read very little at a young age. You give them a book, they can read, but at the end of the day, they cannot comprehend or even interpret what they're reading. For example, the child, if you give that child a book and says the boy put the ball in the box, the child can read it out and say, oh, the boy put the ball. But if you now tell the child, bring the ball, bring the box, the child doesn't really know what a ball is. The child doesn't know what a box is. So that means that even though the child can read, that language is not functional. So it really it doesn't show that a child is well progressed. Another child that may not be able to read knows just single words, maybe can just say ball, can just say box, but can identify what a box is, can identify what a ball is, can actually take the ball. If you tell the child put ball in a box, the child can do it, but the child cannot read in sentences. That child is more advanced, or is at a higher level than the child that can read, knows all the colors, knows all the numbers, but those things are not transferable or applied functionally. So for parents who have children who know colors, who know numbers, and it's a good sign that the child has ability to learn and acquire more language, but it is not a measure of how well progressed they are in their language development. No, because no matter what, any speech or language that is not functional, it's really not effective. And you need to begin to drill back and to be able to begin to work the child up. And also, I want to emphasize that's why the importance or the pressure of making children to know numbers or know letters. Yes, it may be good, but sometimes it's I feel that it should be it should be a lesser focus. Ability to be able to apply language functionally is more important. And things like life skills, day-to-day things, are more important than, say, reading ABCs or writing 1, 2, 3s or knowing colors and all that. Any color you want to teach, begin to teach it in a functional way. They are able to apply it or transfer it into day-to-day life and communicate functionally. So I'll move on to the next slide. There are prerequisite skills for talking. What do I mean? It's just like a house. Before you build a house, you need to get the foundation right. Okay? Because if you don't get this foundation right, the foundational skills right, then ability to build language, will be difficult. And most of the time, people are carried away because people look at a child's age. Oh, a child is 10, so he should be able to do this. And when they now want to start working with the child, they're expecting the ability of a 10-year-old. And there's a difference between chronological age and developmental age. Chronological age is like your date of birth. Oh, you're 10 years old. But your developmental age is the functional age of that child. That means that the ability of that child, what age level is that child? So a child can be 10 years old chronologically, but developmental in terms of milestones, in terms of ability, in terms of the skills that they have in their language, in their interaction, in their development, might be that of a 3-year-old. So so if you want to begin to work with that child, you have to drill down and begin to work from that level they are upward. So there's some prerequisite skills for talking. Things like awareness. So you see some people, they will say that children are not even aware of like the environment. They are not aware. Before you can talk about talking or communication, there has to be awareness. So let me give you an example. I want to talk to you, for example. What happens? I look up, want to have a conversation. I meet you and oh, hello. Hello, who is here now? Marybeth. Hi, Marybeth. You look at me. I became aware of you. Okay, then I initiated a conversation. Then joint attention. Joint attention has to do with looking. I look at you. I'm present with you. Then eye contact. And look at you and we'll talk and we'll begin to go back and forth. So if a child has not even reached the stage of awareness, the child is just lost in their own world, we have to start from there because you cannot begin to talk about language or talking without having prerequisite skills. So it's just like an example I'll give you is this, walking. No matter the age of a person, if they tell you that, oh, this 12-year-old cannot walk, the first thing you think about is not 12-year-old, you want to teach child to walk, they start walking. Remember babies, when a child is born, the first thing that happens is they gain neck control. Remember when a baby is born, their neck is so floppy. After a while, they gain neck control. After a while, they have the ability to sit with support. Later, they can sit without support. Before you know, they are crawling, they can stand up, they take steps and begin to walk. What happens? All those things are prerequisite skills they must have to be able to walk. So if you have a 12-year-old that cannot walk, the first thing you start from the beginning. Does the child have neck control? If the child does not have neck control, no matter the age, you're going to start from that level because they need all those skills. Because to walk, you have to walk uprightly. Your neck must be straight, your back must be straight, your muscles must be must be strong enough to bear the weight. So the same thing with language and talking. They are prerequisite skills you must be able to build in a child before you start talking about building language. So it's not about just forcing the child to read or to say alphabet, to say 1, 2, 3 and all those kind of things. No, these prerequisites, once they are there, they set the pace. They add the foundation. Then we can begin to build language for the child. And I always say language is like building blocks. Okay. Then also in teaching a child to talk, there are things that we must know. You must know your child. Okay, who are you parenting? Some people don't even know the child they are parenting. Are you parenting the child you have or the child you wish that you have? They are two different things. Are you parenting the child that you have or the child that you wish you have? Because some people and they don't know the child they are parenting. And to know your child, do you know your child's temperament? Do you know your child's personality? Do you know your child's learning style? Do you know your child's love language? So that the child is still progressing in their language and speech development. Doesn't mean that most of them, they don't have these things. If you look closely, you will begin to see. You can tell their personality. Remember, Olufolake that came yesterday. She said her daughter is a quiet type, while some children are more more of the extroverted type. Also, their temperament. People like the phlegmatic tend to be very quiet. So do you know your child? Because this is very, very important. Also their learning style. How do they learn? Is your child an auditory learner, a visual learner, or a kinesthetic learner? Okay, or a read and write learner. If you have a kinesthetic learner, they're the ones that will not stay in one place. And you hear parents say that, oh, this child is just always running up and down, will not stay in one place. The child may be a kinesthetic learner, maybe an extrovert, and maybe a sanguine. So what do? You have to understand who the child is so that you are able to help the child. Something to a parent and you're saying that, oh, the child is always everywhere and all that, and you're trying to tell the child to sit down in one place. No, you will use that play to teach the child. Play is the work of a child. So all these things are very important. Learning styles, for example, if your child is a visual learner, okay, that means the child will benefit from a lot of pictures, flashcards, charts, all those kind of, instead of you just saying it. You have some parents, okay, I've said it 10 times, I've been saying it. The child might be a visual learner. So maybe what you need to do is that the things you're saying, just put them in a chart. Have a chart on the wall. Children that struggle with transitioning, for example, if a child is a visual learner, just have a chart. You're trying to teach words, you're trying to teach them things around the house so that when the child needs maybe their favorite things, needs apple, needs water, all those kind of things, and you've told them this is bottle or water or drink, get pictures of those things. If it's in your kitchen or on the fridge, you can take a picture of their favorite things. Okay, their favorite things, and paste it there. So when the child needs it, the child can point to it and say this. Then you echo it. The child points to the drink bottle and is pointing to the chart because the child can see. Then you say bottle or shoe. Take a picture of the shoe, paste it, and the child wants the shoe and it's pointing. Then you say shoe. You bring the pictures. All those kind of, and you repeat for a child that is a kinesthetic learner. Those ones, they learn by doing. They like to do things with their hands. So if you have a child like that, like Olufalake was talking about yesterday, that her daughter likes crafts and likes to do things, you use that skill, that learning style to teach. If your child likes to cook, so that the child has limited language or is still developing their language, doesn't mean they cannot love cooking, they can't love to knit, they might like to play instrument, they might like so many things. So you use that. Your child likes to do things with their hands, then you buy toys that have to do with things like that, or encourage them to do things around the house with you. They can do laundry. Then you use those moments to engage them and begin to develop language. That's what you do. Because anything you want to teach, you must make it practicable. Everyday life, it must become a lifestyle. It's not just, okay, we have a time of the day where we're teaching language. Yes, that can be there, but every day, every moment, everything, because language, speech is conversation, is communication, interaction. Okay, so you use that. Someone asks, what's the difference between temperament and personality? When I'm talking about personality, I'm talking about being an introvert, being an extrovert. Temperament has to do with being a sanguine, being a choleric, a phlegmatic, and a melancholy. That's what yeah, I know that you could have some personality traits in temperament. For example, the most phlegmatics are introverted people. But when you talk about temperament, you go into a lot more detail. You talk about the choleric, being having a tendency to initiate things, being a good leader. The melancholy is a deep thinker. Those kind of things. So the temperament will go into more detail. Even though yes, the temperaments can be classified into certain personalities. Like the sanguines are always the extroverted people and all that. But when I'm talking about the temperament, and some other things you will need to consider. When you talk about the temperament, you talk about the strengths and the weaknesses of that temperament. So you're able to find their strengths, you know their weaknesses, and you're able to help them so they can have a balance on that. Okay, so how do you move your child from where they are to where they should be? Okay, wherever they are to where they should be, you need information, you need tools, you need strategies, and you need to build skills. If there's one thing I want you to think about, is anything you want your child to learn, including language, as a parent, think skills. If there's what I want you to take away, anything I'm trying to teach my child, anything I want my child to do, what are the skills I need to put into my child, or I need to help my child to acquire to be able to master this thing? Because once a child can acquire skills, then it helps them to gain mastery of that thing that you're trying to teach. Okay, so now we'll talk about the goal of speech and language is functional communication. Like I was talking about communication earlier. The goal is not my child knows 1 to 100. My child knows all the alphabets and all the colors. My child can read, because some children can read, but they don't even understand the context of what they are reading. And that is not functional. Okay, the goal of communication is functional. And some children, can say things because maybe they hear things, because there's something we call echolalia, where children repeat things from maybe cartoons or just recite songs, and they just recite it and recite it, and they're not using it functionally. The child says things, but whatever they are saying, you can't even make sense of it. That's not functional communication. Meanwhile, a child may have singular words, can just say ball, bottle, hungry, eat, shoe, and they are using it in the appropriate context, and that's functional communication. So for that kind of child, that child is well advanced than the child who can read but cannot even interpret what he's reading, can count 1 to 100 but cannot use those things functionally. So functional communication is the goal. So whether the child has single words, yes, as long as it's functional, then you begin to progress and begin to build on it. So the most important thing is, first of all, your child's ability to communicate with you. So it's very important, because I see parents who a child comes and says, eat, to tell the parent that, oh, I'm hungry. That's what the child is trying to say, eat. And you hear the child say, I am hungry. It may be too long for them, for the stage they are. Because one thing you have to realize is this: there's a difference between you trying to stretch your child and you demanding from your child what they don't have the ability to do yet. So you cannot demand a skill from a child when the child doesn't have the ability. So ask yourself most times, when you're demanding for something, or you're trying to tell your child to say this or do this, does the child have the ability? That's the first thing you should think about. Don't say, I've said it, that she should know how to say it by now, or she's this age, she should say it. No. First of all, build ability. That's what we're talking about, skills. Then you can now be talking about mastery. You can now be talking about trying to stretch them. So a child that can say one word syllable, you can stretch them to 2 to 3. But a child that is not even saying one word syllable, you're saying, say, I want to eat. Or you said that saying one word syllable, you're expecting a full sentence. No. If the child uses eat and is using the eat in the correct context to say he's hungry, and then take it like that, then you now come and say eat, and maybe it's apple. Then first of all, say eat apple. Eat apple. Before you know it, the child will move from just eat to say eat. So every time he sees that, say eat apple. If it's cookie, eat cookie. So the child say eat, and he points to cookie. You say eat cookie, eat apple, eat. So from there you build it. When the child can say eat apple, eat cookie, the next, and can say functionally consistently, the next thing you say, I want. Then you can now add to it, want to eat cookie, or want cookie, to eat cookie, to eat cookie, to eat cookie, to eat apple, to eat apple. From there, want to eat apple. That's how you progress. You have to progress. Don't try to expect too much. If not, you confuse the child. So the child comes to say eat, and you are telling the child, say I am hungry. You are confusing the child. Do you understand? I want us to take note of that. Functional communication is very important. So get the right knowledge. Get the right knowledge. Okay. And part of getting the right knowledge is knowing what you're dealing with. Okay, knowing what you're dealing with. Some people will say, oh, my child just has speech. Has your child been assessed? Have you spoken to a professional? Know what the right knowledge from the right person, right people, and right professionals. Not what people are saying, not people's opinions, not what your neighbor is saying, not what someone is saying somewhere. Get the right knowledge from the right people, from the right professionals. Okay, so that you know what you're dealing with and how best you are able to support your child. Next, we're going to talk about is tools. We're talking about how to move your child from where they are to where they should be. That means how to help them progress in their language development. We're going to talk about the tools that they are going to use. First thing I'm going to talk about is toys. Okay, I remember I told you that the work of a child is play. I know most people that your kids have toys, your kids have books, but do you know the right toys? Do you know how to use the toys to engage the child? Okay, remember what Dr. Pat was talking about on the first day when he showed you those little children that they were playing bowling, okay, back and forth, back and forth. What children do with toys during playtime is the same thing that adults do when we're having a conversation. So what happens? Like I was talking about Marybeth now. I come, I look at you, I initiate. Oh, how are you? She replies, I'm fine. Okay, I throw in something, oh, maybe, well, what are you doing? And then we keep going back and forth. That's what you can use toys to do as well. So that means that the toys you're going to get your children, let them be toys that would encourage engagement. Okay, that you can use to engage with them, you as the adult, that they can also use to engage with other children. So, for example, if you have other kids, or you have access to kids of their age for them to play with, is a very good thing. So always get toys that would encourage things like turn taking, my turn, your turn. So even things like Lego, if you are building blocks, it could be that I put the yellow, you put the blue. Because what is going to encourage it? Number one, like what I was talking about, the prerequisite, it's going to encourage awareness. It's going to encourage eye contact. It's going to encourage joint attention. It's going to encourage back and forth. And remember what Dr. Pat was talking about. So you when you build language to that interaction, so the child will be able to begin to imitate what you're saying. So when you that's so for people that talk about their kids knowing colors, you use those colors at that time. Oh, red. You can use the colors, you can use the counting, use to build language. Oh, it's a fall around. But you begin to put language to let them be toys that encourage interaction, not toys that will encourage solo play. Okay, toys that will encourage turn taking, interaction, looking up. That if possible, but it depends on the level your child is. Start with one person. So it's not that you now start with like three people. It could be overwhelming that everybody is talking to be overwhelming. It could be one person. It could be you as the parent playing with the child. If they have another sibling, okay, that is patient, they will play with the sibling. Before you know it, two, three people. So what does all happen if two, three people are playing a game? Even if the child is looking at everybody, is watching your moves, can imitate you. Before you know it, it will imitate words that you're saying. Okay, so that's how you use toys. Okay, so make sure you buy engaging toys that will encourage interaction. I know, yes, can be tasking for you as a parent, because sometimes parents just want toys that will keep the child busy so that they can just do their thing. You can buy things like doll houses. Okay, so when you're playing doll houses, they are feeding the doll. Oh, they are cooking. Oh, what's the doll doing? She's eating, eat. Oh, what's it? Time to take a bath. Oh, take a bath. Okay, take off her top, take or wear her shoe, put on, things like that. If your child has like I was talking about knowing your child, your child's interest, your child likes to cook, if you can get a kitchen play set, or let me tell you, even basic things. If your child likes to cook, you unused pots and pans. When we're growing up now, all those plays that we used to play outside, you get empty boxes, you used to form TV. You can be creative with those kind of things, because those things will encourage interaction. If you have other kids there and your child is like a hyper child, you can begin to do things like a public speaking thing, a fake stage. Each child takes a turn. All the other children will talk. Fine, your child might have limited language, but they can express themselves maybe in other ways. They begin to look at how other people are doing things. They begin to see how they are saying things. They begin to imitate. And from there, they begin to build their own language. Do you understand? And you as the parent will serve as the coach to try to, prompt your child, help your child. Then books. Books are also very important, okay? And one thing with books is that you learn to read to your child. There's something we call read aloud. Reading to your child is very, very fair. Even if your child doesn't know how to read yet, spend time daily reading. When we are buying books, look for be very targeted with your books. Don't just buy any books. Okay, I usually will not encourage books that have more to do with all these characters, Disney, those kind of things. Buy more because what you're trying to do with books is they're trying to load, like I was talking about the receptive language. Then the more language the child is exposed to, it's like you're loading up their receptive. Okay, their bank, because it's the bank of words a child has. It's from the bank of words that the child begin to produce. So that's why things like those play that I was talking about, the child is loading up. When you read to a child, you're loading up the child with words as well. So try to buy different kinds of books. If your child has a particular interest, maybe in science, maybe in cooking, you can buy books like that. But buy books that are more everyday, not necessarily all these characters and all that. You can buy a book about science, about fishes, about the solar system. Don't think about the child understand. You just keep reading to the child. Okay, when you keep loading up, for example, a little child, you can buy a book about body parts, you can buy a book about going to school, you can buy a book about the library, you can buy a book about the fire station, things like that. And you begin to, such that, for example, you buy a book about the library, after reading about it, you can take a walk to the library. You can, so don't forget that the child understanding what I'm saying. Yes, the child is, because you're loading up They are loading up the child. So reading to your child, read books. If your child cannot read yet or doesn't have that language, you read to the child, and you have to be consistent with it. You have to be consistent with it, and you can pick a book and be consistent for a little while. So maybe you can pick a book and read the same book maybe for a few days. Before you know it, the child is familiar. Then also, when you're reading, sometimes you might not necessarily just read all the words. Okay, you can describe what is on the page, because you're trying to build language. Okay, and and after a while, you want the child to be able to imitate you. So you open the book. So it's not so beginning, start with books that are more of pictures, have little words. But as you're reading, you'll be creating words, describing what you're seeing. So the child is seeing it. Oh, there's someone with an ice cream, he's pouring something on the bowl. Begin to describe those. Oh, he's wearing a yellow shirt. Yeah, your child knows color. Yeah, and you start saying yellow. Yeah, that's a yellow shirt, a yellow shoe, that kind of thing. So by the time you do that for 3 days, by the third day, by the time you open the next week, the child already knows what is there. He's familiar. Begins to produce some of the words because you've been reading and saying those words consistently. And if some of those things he sees in the book, you now see it. He now sees it in real life. For example, he sees ice cream. Ice cream. The day you go to maybe the mall or something, he sees ice cream. Like he'll be able to say, "Oh, ice cream," because he's familiar. You've loaded his bank with it. Okay. Then digital. There are lots of apps. Okay, that are available nowadays, and their devices. Although I'm very careful when it comes to screens. Okay, you have to be very careful when it comes to screens. Yes, I know there are some apps that encourage speech and language. So what I would always advise is limit the screen time. Okay, make sure if they're using that app, you are in control. Maybe there's a time of the day, certain amount of time that they're using, and you are controlling the access to it. Okay, then there are apps, things like somebody was asking about Gemini app yesterday. Gemini is the way it's designed. It's an app, and you can use it on different devices or different screens, even computer and monitor. But the technology is not designed to be addictive. So what Gemini does is that this repetition that I'm talking about, ability to know they are receptive and help their express. So you have a lot of videos that are closure videos of people repeating words, forming sentences. So it has different levels. Depending on the level your child is, you do an assessment, find out the level your child is. So the videos are there. You can also create your own videos and so many things like that. So now there are lots of apps and a lot of devices, but make sure that you control the access to it, because we all know that screen is not really too much. Screen is not good for anyone, even especially kids. Okay. So now I'm going to talk about alternatives. Remember, I was talking about communication is the goal. Functional communication is the goal. So there are several alternatives that are available to help children communicate. We have what we call the picture exchange communication system, and that has to do with using pictures, like what I was talking about before. Having pictures of your child's maybe favorite things. You can have them pasted on the fridge. You can have them somewhere so that when the child needs something, child can communicate with and point to that picture. But what you do is that when the child points to the picture or brings you the picture of what they need, you echo the word. You echo the word. You're not trying to make them dependent on it, but you're trying to use it to help them build language. Also, you can use picture to like tell a story. You can use pictures to tell a story. For example, you have what happened today. You now say, okay, where did you go? Went to swim. So you use the picture to help the child, to direct the child and help the child to be able to build those words. And with consistency, studies have shown that with consistency, it does not impede language development, because you're not trying to make the child dependent on these pictures or these charts, but you are using them as tools to help the child build language. That's what you're doing. So depending on where the level your child is, if the child has no words, then you start with one word, shoe. As you point to the pictures, just say one word. If the child has one word, then when you point to the picture, the child points to the picture, increase it to two. One shoe, one book. If the child can say one book, then you say I want. But you build on it. Start small. Then when the child is consistent and using the single words functionally, then you begin to build on it. It takes a lot of patience, but like I was talking about, having a process, a system, and being consistent. Then AAC is the augmentative device that Dr. Pat was talking about, that someone was asking about. So also what AAC does is that these pictures or charts, now you now have them, imagine you now have them on a tablet or a device. So usually they can come with the tablet on their own, but nowadays we have them, they design it in such a way that all those things are on an app. So you can download the app on any smart device, any Android um or Apple, so you can download that app. So what on the app you have pictures of general daily things. Also, some of them you can take your own pictures of your child's things and upload them. So for example, you can on the app you can have like home. So in the home, when I mean home now, in the app on the app, there are basic things, maybe kitchen, basic things in the kitchen, or preparing for school, the basic things, the bag, the shoes. So you can have all those things. So the child needs something, wants to communicate, can use the app. Also, on the app, the child can press things like I want this and that. So that's what the AAC does. And like the PECs as well, studies show that it does not impede language development. So you are not using it as just the child to remain that way. Because what you're trying to do is that when a child struggles with communication, ability to express themselves, it can result in a lot of behavioral problems. So a lot of people complain that children having tantrums and meltdowns. Sometimes when a child is finding it difficult, they get, they can get upset and they can get angry and you don't want that. So once they're able to reduce that, you're able to help the child express themselves by communicating. Also, ASL has to do with sign language. So sign language is also an alternative, because you even know for some people, they begin to teach their children sign language even as babies. Babies as little as 1 year, 18 months, they can communicate with sign language as well. So sign language is also a tool that you can use for basic things. So there are basic signs that you can learn. The basic things like eat, happy, thank you, please, reading, toilet, all those things, you can learn them to begin. So but if you want to learn it, you can learn it. But when you use the sign, you echo it, So even if the child uses the sign, you echo the words, so that with time the child begins to identify certain words with certain signs, and it can begin to also build language from there. All these are tools that you can use to help support and progress your child. So let's talk about some strategies. Okay, you have all these tools, you have all these things, strategies that you can begin to implement in teaching your child to talk. So you have to identify your child's interests and use to teach. Okay, remember I was talking about knowing your child. Who are you parenting? Your child's interests, your child's strengths. Okay, it's not about trying to force what you like or what you think the child should like. If you have a son, for example, and he likes to cook, don't say, "Oh, you're a boy. Why should you like to cook? Cooking is a girl thing." No, you use that interest, you build on it, and you use it as a teachable moment for the child. Because what happens when you try to force your child to do what they want, the child gets upset, the child is not interested. And remember, an upset child is not a child that is teachable. When a child is upset, when a child is um crying, throwing a tantrum, and not relaxed, you can't engage the child. You need to be able to engage your child for them to be able to learn. So, and the best way to engage a child, when a child is doing something they like, the child is happy, the child is relaxed, the child, you can easily engage that child, and that becomes a very good opportunity to begin to teach. So find out your child's interest. Okay, if you feel that you don't know, you can always expose your child to different interests, because sometimes you may never know. If you don't expose your child to certain things, how would you know whether they will have an interest in it? So very good things you can expose your child to are includes things like sports. I always say that sports are very good. Engaging in sports is a very good opportunity to teach not just even language, also social skills, because social skills are very important, because you can use social skills to begin to teach language. Because ability to have functional communication is what helps you and enhances your social skills and ability to interact, with the world around you. So, but one thing I want you to notice with sports, the goal of sports, first of all, if you're trying to use it to help your child to develop language and social interaction, is not necessarily the mastery of the sport. No, it's trying to put your child in an environment where they can engage and be exposed to other people and a lot of interaction to be able to build their language and communication. So you have to decide the kind of sport you're going to expose them to, and know the environment and be sure that it's a suitable environment for your child. As a parent, you're your child's best advocate. So don't put your child in an environment where you know that this environment is not really, your child is not really happy or ability to engage in that environment, or it's not a very receptive environment to your child. Are the people there patient enough? Would they be receptive enough? create opportunities for the child to be able to, grow and build their language and interaction. Okay, because they may be a bit behind compared to the other kids. So you have to put that into consideration and pick sports, not sports that are too rough, or because the goal is not the skill. Yeah, first of all, the goal is things like I was talking about before. I was talking about interaction, engagement, awareness, turn taking. So pick sports that encourage things like that. Oh, you pass the ball to me, I pass the ball to you. So for you to pass the ball to someone, you have to look up, be aware, engage, throw the ball. For someone to pass the ball to you, you have to be aware, present, engage, throw the back, your turn, my turn, do this. Those kind of sports is what I would always encourage parents to enroll their children in, but always ensure that the environment is a safe environment that your child can thrive. When I'm talking about safe, I'm not talking about just physical danger, okay? But the social and emotional environment. Ensure that it's safe for your child, because the goal, first of all, is not mastering of the sport, but you want to use the sport to be able to build all these other skills for your child. Other interests include art. Okay, things like painting. I see parents who will say, "Oh, your child is drawing on the wall," and the next thing that you want to pack up all the crayons because it's staining all your walls. And that's not what you do. What do you do? Create a space in the house for the child. You can get the wall and get a wallpaper that is detachable and paste it on, and allow the child to play and paint, or get paints that are washable. Those kind of things. Don't shut off the interest of your child. The child is making a mess. Yes, like I always say, parenting is in the mess. Okay, your child likes arts, then get arts, create an environment. Create, like I was talking about, creating a structure. Create a structure around those interests. Create time for them. Okay, and let them and use that moment. They are drawing. You can draw and use those moments as teachable moments. Begin to build language on their interests. Okay. Okay, I'll answer. Okay, just drop your comments. I can see some comments. I will definitely answer your questions. I'll answer your questions after. Just drop the question, I'll answer. Okay, crafts. Your child likes crafts. That the child has limited language doesn't mean they cannot be good in craft. The child might like to knit, because another thing is this. If you find the strength of a child, it helps to build the child's confidence. Okay, it helps to build the child's confidence, and the child needs that confidence, okay, to be able to build effective interaction and communication. If not, because they have limited language, when they get to certain places or certain environment, they might shut off. But imagine a child, something that is their interest. A child likes craft, child like art. You can take the child for exhibitions, you can take the child shopping to those places, and by the time you're pointing to those things, you begin to use language. Begin to use language on those things. When they do things, name them. Begin to say them. Knitting. Begin to use what? Oh, it's a blue this, a cap, a hat. Begin to use those strengths. Okay. It's not all about maths and English. No, ability to thrive and function in life is not have to do with maths and English. Do you understand? All this will build a lot of skills that will eventually enhance their language and their speech and communication. Instruments, expose the child to instruments, especially if you have a child that you think this child is very restless, can't sit in one place, struggles with attention as well. Because, like I said, a child that you cannot engage is difficult to be able to begin to teach or build skills. Okay, but things like focus and concentration or attention, you teach it as a skill. Let me say it again. You teach focus, you teach it as a skill. You don't tell a child to sit down somewhere for 5 minutes. That's how you're teaching a child focus and concentration. That's not how you teach focus and concentration. Okay, the ability to sit down even to read is a skill. That's why even most of us as adults, we can't even sit down to read because somebody taught us as a skill. So to teach focus and concentration, you use this interest, art, crafts. Imagine you're painting. You now buy to paint. Imagine you are painting drawing that has little columns. You paint blue here, you paint green here. Don't you know that you need a lot of focus and concentration? Arts and craft. Imagine your child is knitting. Do you know what concentration that will build? Threading a needle. Those kind of things. You teach that's how you teach. Musical instruments. Ability to sit down and play the piano. That will teach focus and concentration. Even toys that I was talking about, you buy toys that teach concentration. Things like puzzles, things like Lego. You use those things to teach focus and concentration. Then you are able to now engage your child. But like I said, it has to do with your child's interest. So if your child is not interested in it's one thing, you will look for what they are interested in. And if it's one or two for now, focus on that one and use that one while you build others. You don't want to say that welcome is always this you are doing. You must do this one. Don't do that. Okay. You use what they like Okay, that's their strength. Then you use that to build others. As you build their focus and concentration in what they like, they'll be able to tolerate and be able to transition and be open to other things. Okay, then create learning opportunities. Create learning opportunities for your child. Expose them to different things. Okay, so learning opportunity, talking about follow your child's lead. Remember, for like I was talking about yesterday, needs-led approach. You follow your child's lead. The child likes this, you follow that lead. You don't try to force the child into what the child you want the child to do. Yes, there might be things you want the child to do, but you use what is their strength. Okay, then you begin to build skills that will help them to navigate their weaknesses as well. Okay, so stages of language progression. I was talking about, you have to know where your child is, regardless of the age. Some children have no words, they don't even make any sound. Some people say, I've never even heard my child babble. That's different from a child that has single words, a child that can say sentences, but a child that you now want to be conversational. Okay, so you have to know where your child. So can your child make sounds? Do they babble? Do they have single words? Can they say shoe, mommy? I mean, in the right context now. Yes, or do they have words, but yet they just don't have the words yet in the right context? That's a different thing. So that's why it's about individualizing a child, identifying where the child is support, and then you can begin to move the child to where they should be. Of course, the goal is to be able to have a child to be conversational in a functional way. Okay, but you have to start small and work your way up. So you have to know where the child is and begin to work. Like I was saying, you don't try to time to stretch your child is not making a child that has just single words, trying to make the child conversation. That's not stretching. You stretch. If you want to even stretch, you stretch. This is their level, this is their ability. Okay, then you want to stretch the next step. Don't expect from a child what the child does not have the skill or the ability to do yet. Okay, that is not fair, because it's like you don't have the ability to do something and someone is expecting you to do because you're a certain age or because you have said it so many times. Okay, does the child have the skills? Is different from when you're just trying to make the child gain mastery. Okay, you expect mastery from what the child already has skills, or you expect them to reproduce what they already have skills or ability to do. Okay, so these are the stages, and we move them progressively. So I want to talk about these strategies. Okay, these are known as verbal behavior approach, and usually the first thing when a child is trying to learn language is ability to request. Okay, so before you start expecting a child to be conversational, be able to answer you when you ask this question, one of the things you can do to help them is, because normally children would like to request for their favorite things. Most children have favorite things. Either they have a favorite teddy, they like, they have a favorite bottle, they have like one, two, three things that you know that those things are their favorite things. So if your child does not have language at all, or has just one syllable, you can use those favorite things, okay, to begin to use to build language for them. So if a child has no words, for example, and most times as parents, you know what your child wants, even without even saying any word. You know that he wants, maybe they are pointing to it, or they take you to the fridge and you know that they want a drink or apple. When you pick that thing, you hold it close to your mouth and you repeat apple. You come down to their level, you are slow, you repeat before you give it to them. So that they take you, they don't just carry the thing and just give it to them. Okay, but I'm not saying that you should now hold on to it until they must say it. You know, depending on their level, repeat and repeat and repeat. If they just make a sound, even if it's not the right word, cheer them on, like, oh, like they said the right thing. Okay, because sometimes if you hold on too long, the child will get frustrated and may start crying and throwing a tantrum, and you don't want that. Okay, so repeat using their favorite thing, their favorite teddy. So once the child can begin to say their favorite things, so that means it becomes easy. The child is hungry, be able to say apple, then before you know, you start saying eat apple. So once you're able to say eat apple, keep saying eat apple, that's his favorite um thing to this thing. So the next thing is eating rice. Say eat rice, eat rice, eat rice. Okay. So he wants a drink, drink. Then next thing you start saying want drink, and there are some words that you can generalize. Want apple, want drink. So don't use too many things. If you are using eat or hungry, choose one. If whichever one the child picks. So don't say eat to describe wanting to eat and being hungry, and tomorrow you use hungry, and you're going to confuse the child. So want apple, want drink, want shoe, want bag, want teddy, want or do you understand that kind of thing? So start with so when they can say want this one, they can say I want, I want, I want, I want. Do you understand? Or maybe go outside, go toilet, go play, go. Right now, tenses are not important because I see parents, the child is saying the thing in the right concept, but maybe the tenses or the even we all know that even adults still blow grammar now. So so the focus, like I said, is functional communication. You work on the tenses later. So yes, I'm not saying you should not correct the child, but don't, when the child is making that effort, respond to that effort first of all. Then even if you want to correct, when the child says it, don't say, what are you saying? Say this. No. Just say the right thing. Maybe the child wants to say, I want, and the child says you want. Just repeat the right thing. That's what you do. The child says the wrong thing. Don't say that's what you said is not wrong. You now say no, you're all those things you're saying is too much for that child. You need little words, okay, so that you don't confuse the child. If all those things you say won't get across to the child, okay. So after teaching the child to requesting for their favorite things. So when they can request for their favorite things, build language with that. Want shoe, want bag, want toilet. Maybe that's what they means that they want to go to the toilet. Want apple, want drink, want teddy, want shoe, want, just use it like that. Or go, they want to go to school, go school. Even if it's go school, go toilet, go. If it's functional and it's consistent, then begin to build on it and then be correcting tenses. Don't focus on the tenses first of all. The child communicates to you. If it's functional, acknowledge the communication first. Don't focus on correcting because it's not going to, by that, don't focus on the need to correct. No, focus on the need for the communication to be functional. Then you deal with the tenses later. Then ability to point. So what I was talking about before, you expose them to different things. Okay, so in the bit to play, you are exposing to red color, you're exposing to this. In reading books as well, you are exposing your pointing. So when you go out, you see things, you can point and name things. You can even do games around the house to just go around and name things. Okay, so that way with time child begins to point to those things. Okay, then also now getting the child to repeat after you, so that's why things like reading, because normally when the child starts, when you start reading and you are reading, imagine you are reading a book for a few days or like a week, the same book. By the next day, certain words, the child will be repeating those words after you. Do you understand what I'm saying? So you begin to work gradually. You break it down piecemeal and begin to build, because remember the goal is functionality, functional communication. Okay, so if the child is communicating functionally, then you build language on that functional communication. Not say this, you didn't say it correctly, or you focusing on tenses. No. Then you build skills. Remember I said, think about it this way. Anything you want your child to learn, any area of life or area of development that your child has challenges with, think skills. As a parent, if there's anything you take away from this place, anything, you want to teach your child chores, you want to teach your child to read, to focus, to stop jumping around, anything, think skills, building skills. And remember, you cannot beat skills into a child. You cannot yell shit. You cannot talk skills into a child. You teach it. And what is teaching? Teaching is not saying. Teaching is you get the right knowledge and information. You have a system, you have a process. You are consistent and you're intentional. And you work. That is building skills. Okay? So, like I was talking about prerequisite skills before, focus. Because you need a child to be present with you for you to be able to teach and communicate with the child. Okay, if the child is not present with you, anything you are saying is not really entering. Focus and concentration, I talked about that before. You use toys, use activities to teach focus and concentration. Okay, so that's such that you are building the child's what do you call it, attention. So you can build the child's attention span and gives you more opportunity to interact with the child to be able to teach. So, because for example, the toy time that you're playing with the child, if the child lacks ability to a long attention span, yes, I know that children attention span can be small, approximately twice their age in minutes. That's the average child's attention span. So just think about it, that it's not about getting them to sit down for 1 hour. No, don't get them beyond their attention span. I can give them breaks, but you can build their focus and attention with activities, with things that they're interested in. Those are learning moments, they are learning opportunities, because you want, when the child is present, the child can engage with you, then you can use those moments to teach. Then social skills. Social skills is one of the skills that when you build in a child can also enhance their communication and their language. Okay. And I was talking about sport, things you can use to build social skills. Social skills is not just going for go for birthday and just go out and socialize with people. No, be very intentional when you're trying to build social skills. Think about the environment, think about what is going to happen, then think through the process. Okay. So if you want to organize things like play dates or dates in the park, be very intentional because your goal is not just to go to the park and just leave the child to just do whatever or wander around. No, you want to encourage interaction with other kids. So even if it means going the extra mile, okay, approaching people that you know, organize a deliberate play, they go to the playground. Depending on how social your child is, you can go there and join in the play. Because most time when your child sees you with other kids, if your child is not really social or your child is more of an introvert than a quiet person, when he sees you with other kids, the child will come and join you now. When you go to his class, if a child that is going to school, begin to interact with their classmates, whether or not they're their friends. Go the extra mile, be the fun mom or the fun dad, and play with the other. When he sees you getting out to play with other kids, before you know, he or she will come and join you, and you begin to facilitate, activities and things that encourage social interaction. Sports are also a good way to build social skills. But like I said, be very mindful, be very intentional when you're picking sports. And remember, the sport or the skill of the sport is not the goal, is what happens. This is what encourages interaction, initiation, awareness, contact, turn taking. Those encourage them. Play skills. I mentioned a little bit about that. Play skills. If you have other kids in your house or other siblings, pick a lot of activities that encourage play. Things like, when we were young, we used to do this dancing around the chair. Remember that any activity you pick or any sport, the focus is not perfection. You want to use those moments as teachable moments. You are very intentional on what you're doing. So that activity we used to play, I know most of us will know that activity, dancing around the chair. Almost all of us, when you went to parties as a kid, we all did it. But there's a way you can modify that dancing around the chair now. Don't take away the chair. Because the goal now is that you're not trying to pick a winner. So even if you have 4 kids, including yourself, making 5, you can have 5 chairs, you play music, or someone is there stopping the music, you all dance, 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 you sit when they stop the music. You are encouraging play, interaction. So that play, that moment, you begin to build language. You are mentioning this person's name, you are saying this person, or you take charge. If there are other kids there, you want to teach your child those skills. You indirectly give those other kids direction. Okay, your turn, you do this. When your child sees that, then after 2 or 3 kids have done, he's seen them do those things. Like the video that Dr. Pat played, your child will be able to imitate. And as they're imitating, build language. So do things that encourage interaction. Okay, toys, activities that encourage this kind of things, and that way you are going to encourage your child to begin to communicate. And once they can begin to communicate, then you begin to add language, to their functional communication. Then self-care is very important. Like I said, things like math and English are not only the things that your child can learn. Self-care activities around the house, you can teach your child cooking. And the child has language, it doesn't mean they cannot learn to cook. Expose them to different interests: cooking, doing house chores, cleaning, vacuuming, what do you call it, laundry, all those kind of things. You can use it. Even showering themselves, you can use it to teach body parts. I wash my dish. Begin to do it. But remember, I said break it down. Don't just give instruction. Then, like I said, know your child. What is your child's learning style? If your child is a visual learner, these things that you want to teach, break it down and get a chart. You can get pictures. You can use your phone to take pictures if you find pictures online of what you want to teach. Okay, you want to teach a child how to shower. How do you break it down? Night routine. Break it down. What's the first thing we do? We lay our nightie on the bed. Enter the bathroom, maybe brush your teeth, but make sure that the routine is consistent, the same thing. That's what I was talking about. If you don't have a system and a process, you won't be able to identify your child is struggling. So you just say the child should go and do. So today the child does it this way, the other day the child won't master it, won't learn it, and the child will struggle. So have a system and a process. So anything you want to teach your child, let's see, have a system, break it down. If your child is a visual learner, get a chart. If it's an auditory learner, recite it in a certain way. You do this, then this, then this, then this. Those are opportunities. Because what you need to do, you need to create lots of opportunities, lots of activities in day-to-day things that the child can do. Cooking, the child can join you in the kitchen while you're cooking, you're talking, you're interacting. And if you have other kids there, You begin to talk, you use words, okay? In learning those skills of cooking, of blending, of cutting, you use language while you are doing those things. That's how you build, because language, communication is a daily thing. You're not just learning communication for a certain thing, you're learning it as a life skill to interact generally. Okay. Um, the next thing, what are the obstacles or other challenges? And this is very, very important, especially for people who maybe your child is not only dealing with a speech delay. Okay, you might think, oh, it's just speech delay because that's what's apparent to you. But if there are other factors, other things happening, this may be obstacle in developing speech or in overcoming the speech delay. Things like behavioral problems, meltdowns, tantrum, what we call sensory processing issues. So you have a lot. Some children are sensitive to sound. So if you have a child that's always covering his ears, he doesn't like loud noises. Some children are sensitive to sound. Some are sensitive to taste. So those are some of the things that could be going on that you may not know. So if your child is, for example, maybe a picky eater, my child might be having some sensory processing issues because some children are sensitive to certain textures of food. Some children are sensitive to some textures of clothes. So you know that your child doesn't like wearing some certain clothes. It could be a sensory processing issue. Okay, they're sensitive to noise, which is the auditory one. So the normal noise level that we can tolerate, some kids cannot tolerate it. So some of these things, these factors are important, because if you don't consider this, they can be obstacles to your intervention. Okay, it's just like saying that you're having headache and someone is trying to tell you to read. You understand that kind of. And if a child has limited language, they may not be able to express these things they are going through. There are some other medical problems. Okay, a child might be in pain from headache, pain from even constipation. But so you see the child is always slouching, always trying to press their tummy against something, always grabbing their head. The child may be in pain, but because the child doesn't have the words to express it, so there may be other medical things that are going on. So if these things are not addressed, they could actually be obstacles to effectiveness of your intervention or therapy. So that's why it's important to have your child assessed. Okay, so even if yes, what is apparent to you now is just the speech, for your interventions to be effective, you have to think about things that could be obstacles or other things that could be going on. And that's what will lead me to when I'll talk about medical conditions that could be associated with speech delay. Okay, a lot of people say, oh, my child doesn't have autism, my child has speech delay. Just be sure that you've had your child assessed. And then remember what I said, it's not really about the diagnosis, okay? So things like autism, there's speech delay, and could be other issues. There's some children that even diagnosed with autism that don't even have speech delay. The main challenge they have is not in really speech. Even when we're going to talk about speech delay, it could be different things. Do you understand? It could be articulation of speech. There could be different levels. Also, Down syndrome. Some children with Down syndrome also have delay in speech. You have apraxia as well. You have cerebral palsy. So there could be different medical conditions. And why this is important, and that's why it's important to have your child assessed. Because if these conditions are there, there could be other things you may need to consider. Some children have issues with the muscles of their mouth. So that's where the issue is. And some other things could be going on, okay? So it's very, very important that we consider that. But remember, either way, whether your child has or speech delay has all these other conditions, because these other conditions, it just helps you to know other things you're dealing with and you need to factor, and other areas you also need to support your child in addition to speech. So it's very important. So what are the next steps? Number one, you have to take responsibility. Okay, as a parent, individualize your child and get help. That you are here for this conference alone, it tells me that you're interested in supporting your child and getting help for your child. Then find a good support system. A good support system. A lot of people might be concerned and may care, but they ensure that you're in a positive environment and you're having a good support system. Then get a professional to walk this road with you. It's not about, a lot of people are concerned, but are they equipped with the right knowledge, with the right information to really support you, or you just hear say or hear this and hear that, just try this and try that. Get a professional to walk this road with you, because indeed it can be a journey. But like I always say, every parent is on a journey. Every parent is on a journey. And once you're a parent, you're a parent forever. It's just that the challenges you're facing on the journey may be different. So that your child has challenges with speech is just one of the challenges. Another parent, their child has challenges maybe in mathematics or in physics. They're going to support their child. Can get a tutor. They can change their school. So they're going to support the child. So your child has a challenge with speech. Yes, you take responsibility. You get help and get a professional to walk this road with you. Now I'm going to introducing the milestone acceleration method. This is a program or a method that I designed to support parents in helping to accelerate or support their children who have developmental delays. Okay, I use it a lot for parents who have children diagnosed with autism. It helps with their speech. So I deal with speech social, even other medical problems that I talked about, talking about nutrition. There's so many aspects that I can't even cover in this presentation or even this conference, because someone asked me, say, well, what about nutrition? Yeah, I know there's a component of nutrition in supporting speech, even in supporting children that have autism, but there are so many things that you cannot pack or even talk about this in this presentation. There's so many things talking about the speech. There's so many things to consider. Was the child developing regularly and the child regressed, or the child has always been slow development? And there's so many areas that you need to work on. Like I said, it's a journey, it's a process. Okay, so the milestone acceleration method is a program that I designed to support parents of children with autism, support them, and also parents of children who have speech delay, developmental delay, social delay, all these areas. It covers these areas. Okay, so and I'm going to be introducing this program, and for anyone that will be interested in working with me, like I said, get a professional to walk this road with you and to support you and your child on this journey. So for anyone that will be interested, I'm going to be opening another batch in May. I'm going to be working with just a limited number, because I don't like working with too many people, because you have to give attention to detail. There's so many things to look at, there's so many things to talk about, and I'm going to be supporting these parents. So anyone that will be interested in this program, I'm going to be opening in May. We'll be getting more details in the groups about how everything will go on. So thank you everyone for today. Now questions. Let me stop sharing. Okay. Yes. Thank you, everyone. Now I'm going to answer your questions. So if you have questions, let's drop our questions in the comment section. Okay. So let me look at a few questions. I have some questions here. Let me see. Okay, someone said difference between temperament and personality. I think I answered that. Someone said, how do you work with a child that's communicating with gestures instead of words? That's why I said it's that a child can even communicate with gestures is very good. What you need to do now is begin to build language. Okay, you begin to build language. Like I said, one of the things you can start doing, first of all, start with the child's favorite things. You know, the child will request for certain things, their favorite things, maybe their favorite teddy, their favorite bottle, they like their favorite fruit, banana, apple. So when the child maybe the child wants a banana, for example, and maybe the gesture is that the child will take you there to the place instead of saying, well, when you get there, you hold the banana. And the best thing to do is to come down to the child's level and hold the banana, and you say gently, banana, banana, banana. Even if the child can say na or nana, with time, the child will be able to echo and repeat what you're saying. So you use the child's favorite things, okay, to start um to model the word so that child can imitate. Also, I was talking about activities and toys that the child likes. So you use activities and toys and things that are engaging, especially the things that the child likes, not the things that you think that the child should like or the child should do. So the child has favorite, he likes to play Legos, likes to play different any activities really. So you even if it's play dress up with teddy, play cooking with pots or whatever, you use those opportunities to begin to engage with language. Engage, because that interaction, when you can engage the child, then you begin to use language and words. If you have other kids around, other people. You can get them to join in the play, and you use turn takings, imitation, activities that will encourage the child to look up, look at you, take turns. So if you're going to take turns, for example, if you have another child, that you model things like my turn or take, that kind of thing. So when the child has seen that, before he can get the thing from me, he has to say take, take. So other kids will be there, take, take. So before you give the child, you hold a little bit, you wait a little bit for the child to take. Now another thing you can do is that you can start by like you want to start to say take, for example. You can just like take, although you say it with time, with repetition, with consistency, the child will begin to model those words. Then you start with single words. It might not be perfect. Like banana, I can say na or nana. Remember, the goal is functionality. So when they work on, when they can use those single words, then you begin to shape it, then you build on it. Okay. I think the next one. Someone asked, teaching them sign language, would that not stop the child from trying to speak? No. Studies have shown that using sign language, using the PECS, which is the picture exchange communication system, using the augmentative device, they do not stop. So that's what I said. When you want to use it, you model the word. You don't just do the sign and not say it. So, do you understand? So, for example, this is the sign for water. Water. So if the child wants water and the child grabs a bottle, you model it and you say it. And usually, most of the time, when you say it, you have to like be extra as a parent. Don't just say what. No, you know the way if you watch kiddies program, all these adults that are the entertainers, you know how they do it. They're always extra. It's like your mouth wide, gesturing. That's how you do it. So if you want to say the word, you don't just say what. No, that's not. That's not how you do it. Say what. You have to. You understand? Go extra, because what happens is this. So when you the way you are doing your mouth, especially if you come down to the level of your child and your child is looking at you, the child is looking at the way you move your mouth. And that's one of the good things about the Gemini app that I mentioned. They have those closure drills. So with consistent repetition and the way you move your mouth, water, water, whether you say water, water, whatever, you say it and you do the sign. Okay, we say thank you, thank you. You do the sign, you say the words, and you say it loud, clear, and you repeat it at least maybe like 3 times. So you don't just do the sign, you repeat it, you repeat the words with doing the sign, because what that does sometimes, so what some of these alternatives do is that they help to reduce frustration for the child, because most children, when they struggle with expressing themselves, that's why some of them will start throwing tantrums, because they see other children, they want something, they say something, they get something, they are mumbling or wanting something they cannot express. What happens? You're going to be upset because they're not getting through to you. And remember, for you to be able to teach or get through to a child, you need the child to not be in an upset state, because an upset child is not a child that can be receptive to any learning. So anything you're saying when a child is upset and angry, it's not really entering. So that's why if every time the child does something and you feel that that's when you're correcting and saying that period, those is not a teachable moment. So you don't want to avoid that. You want the child to always be in a state that is receptive to whatever you're trying to pass across. Okay. Someone said, is there any age limit for a child to develop language? There's no age limit, okay? But of course, the progression may be different, because, for example, you have a child that is maybe 3 years old now, and the child is delayed in language. The child maybe at 3, the child has a language of a 1 year old. That's just a 2 year gap delay that you're trying to help the child catch up. But if you have a 15-year-old now, and the child's ability is that of like a 2 year old, that's 13 years. It's not that it's not possible, but of course, you know that the progression may be different. And that's what I said. Like, also, you have to consider other factors. If there are other things involved, like they have other conditions. Okay, so there could be other factors around that condition that could also affect or be impeding the progression. And that's why things like, when people ask things like, oh, nutrition, all these other things, because what happens is this: you have to think about the internal state and the external state of a child. So normally, what happens is when a child is learning and growing, there's so many things that the child learns by default. But have to know that even though it looks by default, it's not really by default. Fine, you never really taught a child to walk, but a child sees people walking. If you lock a child in a room for 2 years and never sees anybody walking, anybody talking, the child will not talk, the child will not walk. Okay, so but what happens sometimes is that if there are some other things going on internally, it would impede the external intervention you're trying to put in. So if some of those things are dealt with, it can make the progression faster. So when you hear people say that, oh, when they change the diet to gluten and casein free, the child started talking. So it could be that what happens is that the because the gluten and casein, it could affect the internal environment of the child. So it's impeding their child's ability to learn. Okay, so when some of those things are dealt with, it makes the progression faster. So it depends on what the child is dealing with in addition to language. But the truth is that there is no age that you cannot begin to support and help a child. Okay, there's no age that you cannot begin to support and help a child. The progression, the journey may be different, but the child can definitely be helped. Okay. Someone said this method has really helped my son. I'm happy about that. What if the child preeminent sound before it actually happened? I don't understand this question. What if the child preeminent sound? I don't know if you can clarify that. I'm sorry, I don't really understand what you mean by that. Okay, can I type the name of the app? Yeah, it's Gemini app. Don't worry, I will type it. It's called I would likely do I would likely do a session on that. Gemini. It's a very wonderful app if you know how to navigate it. Let me just show you. That is the name of the app. Okay. Someone said the child covers their ears. I don't understand what you mean by the, what if the child preeminent? What do you mean by preeminent sound? I don't know. Before it actually happens, I don't know what you mean by that. Child covers their ear. The child sensitive to sound. Yeah, the child could be. How you know the child is sensitive to sound is a normal noise level that is okay for every other person. Maybe you see most of the time you see some of those children, they tend to cover their ears a lot, and sometimes you even have this what we call them these earphones, sound blocking earphones, because they could have or the what we call auditory processing, so they are sensitive, they're hypersensitive to sound. Some children have that. So I don't know, is that what you're talking about? Child is sensitive to just normal TV sound, normal everyday sound, because it could be overwhelming. So just imagine someone puts you in a stadium is filled and puts you on the stage and you have stage fright and every stadium is very active. You know how you feel with the whole noise. It feels like you're overwhelmed. That's how these children feel, even in the normal, what you call normal sound level. That's how they feel, when they have that. And there are other strategies in helping children to deal with that noise block. There are a lot of therapy, music therapy, what do you call it, listening therapy, and other things that you can do to support your child if they have that. I'm sorry, I don't understand this that question. Does speech delay affect a child's nutrition? Which professional can assess my child's if he has a problem with the muscles of the mouth? Because my child of mouth takes only pap as plus and has already been assessed by a pediatrician. Um, it's not. It's actually this question is funny. It's actually the other way around. When you say speech delay affects your child's nutrition, I don't know what you mean by that, but the thing is that if a child has challenges with if a child has challenges with what do you call it, some muscles of the mouth or food sensitivity and sensitivity to other food, it could affect speech. Okay, so it's not like the speech delay is affecting the nutrition. The speech delay is like a symptom. It's something that is showing you that other things are going on. I think that's what the speech delay is showing you, that other things are going on. Then when you talk about when you say he only takes, is it like he refuses other types of food? Because it's the food that you have exposed him to. So what happens when you give him those food? Is it that he just refuses them or other things? So when you say he's been assessed by the pediatrician, what did the pediatrician say? Did they recommend a dietitian, a nutritionist? Even speech therapists can also assess. Speech therapists that are trained in that area, they can also assess. So maybe I don't know who this person is. Maybe you can chat me up on it later. I'll talk about it more because the speech delay could just be a sign of something else going on. So it's not like the speech delay is affecting the nutrition. Okay, and also you have to look at the nutrition. The nutritional deficiencies is a muscular problem with the mouth and all that. 'Cause some children have muscular problems and some other things like that that could be affecting. So the speech delay is just a reflection of something that could be going on. So it's not the speech delay that's causing nutrition. Okay, so put it that way. Correct, but the question is, why would the child premeditate a sound? For example, before they get into a park, they start to block their ears even before entering the building. That's what I'm saying. That's what you're thinking, that they have not entered the building. They're not premeditating a sound. Even the external environment can be overwhelming for them. That's the thing. The external environment. You are not hearing a sound. Okay, let me say it this way. You know that even when the room is, sound has different what we call decibels. So that you are here now and you're not really picking anything doesn't mean there's really no sound or echoing in the environment, even if you are not picking it. Do you understand? So don't so that they were blocking some of those children, you see them walking, though they are blocking their ear because the normal sound level that you think is quiet, they are hypersensitive. So a normal sound level is extra for them. That's what is happening. So you think that there's nothing, but that so-called stable environment can still be very overwhelming. And there could be other things in the environment that also cause overwhelm and stimulation for those kind of children as well. There's so many other things you have to look at. You have to look at stress. You have to go shopping, spend extra hours. It could be overwhelming for them. Crowd can be overwhelming for them. So and sometimes some of those children have a bit of anxiety. They could have other things that are going on. So that's why some things that you think is normal level or tolerable for them may be a bit too much for them. So I hope that helps. I think I've answered all the questions here. Let me see on Facebook and YouTube if I have any questions. So you can still drop a few questions if we do have questions. Let me see. Okay. One second, let me just see Facebook if there are any questions. Thanks everyone for coming today. I appreciate having everyone around here today. Let me just see on Facebook. I don't think I can see any questions. Okay. Okay, I don't think I can see any further questions. Let me see on YouTube. If we have any questions on YouTube, we're streaming live on our YouTube channel as well. So, am I checking the right place? If we still have any questions, we can ask as we round off the conference. Thanks, everyone. It's been 3 days of. Let me see if I have questions. If we have questions on YouTube. Okay, I think we are all good here. So, thanks everyone for joining me for these 3 days. It's been amazing overcoming speech delay. And if you have any further questions, you can chat me up and send me a message if you need further clarifications. And as many as will be interested in working with me and working this journey with you and your child, enrolling for the Milestones Acceleration Method program. I'm going to be starting in May. First week in May, we're going to be rolling out, and I'm going to be taking a limited number of parents. So if you, or just leave them. Who's that? Sister. Okay. So should an adult ask the child to remove their hands from their ears? No. And that's what I said. Okay. You always have to think, when your child is doing anything, okay, always don't parent the act. Parent the heart. Parent what is really going on. If you feel your child does something, the first reaction is not the act. And I know sometimes for parents, some parents feel like the child is embarrassing you, you want the child to behave. It's not about your parental ego, okay? A child throws a tantrum, a meltdown in the mall, and you feel the need to, like, so that people will think that you're a parent that is in charge and in control. That's why you want the child to do that. A lot of these people are ignorant, they don't know what's going on. So you need to always do what's best for your child. Okay, if your child is having a challenge, it's like I asked you, if I put you in a stadium, you have stage fright, and the stadium is filled to the brim, and there's a lot of noise and music going on. How do you feel in the midst of that sound? You feel overwhelmed. And at that point, I tell you to do something, and I'm expecting something from you, and I'm feeling overwhelmed. How would you feel? That's unfair, because at that point you don't have the ability, you're struggling with them. That's the same way your child is feeling. So taking the hands off, does that help the child? Or it just makes you look good, or the child is not embarrassing you? So think about it that way. Okay, so if that is what is going on, then you need to investigate further and put strategies that will help the child. What I remember now, they call them noise cancelling headphones. They are a temporary they are they are temporary measure that the child can use. That these headphones, they will look very fancy. It's just like the child is listening to a headphone. So they are noise cancelling headphones that the child can actually use. But most times it's always better to find out what is really going on and strategies that you can begin to use to help the child. I've typed the app. I said it's Gemini. I typed it earlier. Don't worry, I'll type it on again in the group. Gemini, GEMINI, I think. That's the name of the app I was talking about. And the links that Falaka was talking about, I'll drop those links in the group. Okay. How do you help a child as a kinesthetic learner to learn in a structured environment? Yes, what you're going to do, you're going to have to teach the child focus and concentration. When you say structured environment, what is the structured environment? Remember, I said my favorite quote yesterday: if a child does not learn the way you teach, then you teach the way the child will learn. So you have to teach the child using the child's style of learning. So you don't force the child into a structure. So, and that's what happens sometimes in classrooms. A teacher is trying to use the same method. Oh, sit down there. Can a aesthetic learner in classroom, the teacher has to be well educated that these are kids that will need breaks. They're not kids that will stay long on 30 minutes. They need breaks. So what do? You incorporate breaks into your teaching. So if they can sit for 5 minutes, teach, let them go and play. Then you teach them with play. So the kind of toys you buy for them will be things that they do with their hands, all this constructive. So sometimes you notice your child likes to dismantle toys, dismantle cars. The solution is not that you won't buy them toys, you buy them construct, start teaching them constructive things. So buy them things, toys or things they can put together. Buy them Legos that they can put together, spend time to put together, or cars, or things that are in piecemeal that they can put together. Start teaching them to put things around together in the house. When you buy like a new vacuum cleaner or you buy a new equipment or whatever, you need to or bicycle to put them together, get them involved. Those are the things you begin to use to teach them. Okay, if they are a little older, start teaching them music. They learn how to play an instrument. To learn how to play an instrument, you need focus, you need concentration. Okay, so explore different areas of interest, then use that ability to teach them. Don't try to force. You can't force the child into a structure that won't work with their style of learning. Yes, they will need to learn other ways, but first of all you use their area of strength, which is their style of learning, to build focus and concentration. Then you begin to teach them ability to cope with other styles of learning, visual, auditory, and other things. So I hope I answered that question. No, I'm not having a conference in May. I'm launching a program. I'm taking parents that I want to work with me to help support their children. That's what I'm starting in May, not a conference. So you can get in touch with me. And I guess this person is in the group. The person that typed the question. If you're in the group, just or send me a message. I'll definitely reply. Yes, I can't see who types that question. I'm trying to see. I'm sure the person is in the group. Yeah, so just send me a message and I will share more on that. I've typed the app. Who is that person? That's yeah. The app. I said the app is that's the name of Yeah, that's the name of the app, Gemini. That's the name of the app. So thanks everyone for joining me today. So great to have you here. Appreciate it. 3 days I have to go now. It's been such a wonderful time. Day three Autism Renewal Conference. Day three. So 1 second. Now we have to go, but before I go today, I'm gonna play my music. I need to have we need to have a goodbye song, don't we? Yes, we do. Let me play. I want to play some music. Don't mind me. I need to play some music before we go today. You need to join me to dance today. You need to join me to dance. So you're gonna dance. Thanks everyone. See you all in the group. Send me a message. I'll be happy to.
Yeah, I'm gonna call it right now. I think I found the single biggest.
Sorry. Why is my internet? Yay! Okay.
The nations are waiting their cry, expecting you to come. The nations are waiting their cry, expecting you to come. Don't disappoint, don't tarry, go for them in power. Don't disappoint, don't tarry, go for them in power. You go, you go, you go. To the mountains and the hills, you go, you go. Bankers go, everywhere across the nations of the earth. Doctors go, we will go. Nigeria is waiting their cry, expecting you to come. Botswana waiting their cry, expecting you to come. Gabon waiting their cry, expecting you to come. Don't disappoint, don't tarry, go for them in power. Don't disappoint, don't tarry, go for them in power. We'll go, we'll go, we'll go, we'll go to the village, we'll go, we'll go to the cities, we'll go to the rural areas, go to the high and the mighty, we'll go, we'll go. Belgium is waiting their cry, expecting you to come. Croatia is waiting their cry, expecting you to come. Romania, they're waiting their cry, expecting you to come. Don't disappoint, don't tarry, go for them in
Thanks
power.
everyone. I
Don't
see
disappoint,
you
don't tarry,
next
go
year.
for them in power. We'll go, we'll go, we'll go. We will go to the sick, to the oppressed, to the failing ones. We will